want to say a big thank you to everybody for coming. A special thank you to all of my patients, because it takes a little extra effort, a little extra work to talk to people about what it is that might be able to be beneficial to them and to help them, to take time out, bring you to a dinner. And so thank you very much to all my current patients, and thank you to all the guests for showing up tonight. I hope you enjoyed the dinner. Usually they do a fantastic job. And that Kona chocolate dessert is fantastic. So unless you have connections and you got a fruit plate, but you know, not all of us have those extra connections. So upper cervical care. Before I start off talking about what upper cervical care is, I'd like to talk a little bit about what upper cervical care is not. So when we're looking at our typical medical model, when you go into the hospital, one of the things that is the best in the United States about our health care and about our medical model is emergency care or crisis care. You know, if you have a heart attack or a stroke or a broken arm or something like that, there's nowhere in the world that you would rather be than in the United States, because we have the ultimate care for emergency care. Where we really drop the ball is the other 80% of people that are in chronic pain or chronic illness. So if you have migraine headaches, or if you have fibromyalgia, pain in the low back, numbness tingling down the arms, these type of things is where when you go into a medical professional, you get a couple options, and that's drugs, surgery, or there's nothing really else I can help you. And one of the things that's especially frustrating to me is that you get these two options and then they don't acknowledge that there's any other option out there. So there's no healing option out there. I actually even had a lady that came in to me. She had numbness tingling going down the arms, and she went to her doctor, and her doctor said, well, we're going to give you some injections, you know, and that will take away the pain and takes away the inflammation, should help the inflammation. But we did an MRI, you're not quite bad enough for surgery. But hang in there, we'll give you injections. In 5 years, you'll probably be a candidate for surgery. I'm like, are you kidding me? You know, but never an option about how to help the woman. It's, you know, we're just assuming that you're going to go down the hill until you need surgery. So most of my patients that come in the door are patients that, you know what, I don't want those other options. There's got to be other options out there. There's got to be a way that I can heal, not just continue down this path until I need drugs or surgery. So how is upper cervical care? Because I am a licensed chiropractor, but how is it different from standard chiropractic? Well, first of all, I don't do any twisting, cracking, popping. That's the big one that everybody goes, oh, thank God, you know, especially when you're dealing with the neck, right? But I don't do anything unprecise. In other words, my corrections are very precision calculated. I measure down to a 1/16 of a degree exactly the calculation that we need to make, and I make a very precise correction to the top bone in the spine, the atlas, and I'll explain why in a minute. And we put that bone back exactly, very gently, where it's supposed to go. When I say very gently, my patients can concur to this. Most patients get up off the table after their first correction and go, that's it? That's all you're going to do? You know, because we're waiting for this big crack, and it doesn't happen in my office. The other thing is the care is progressive. Generally, when patients come into my office, they start healing. And what that means is that I start seeing my patients less and less, because as their body starts changing and as they start holding their alignment, they start healing and they start to progress and get better. So the last thing here that I have is that it literally changes the posture of the body. It's one of the only things that actually changes the posture. When I was in Kona, I first started in Kona, if some of you don't know that, about 5 years ago. And I had one of my first patients, 81-year-old lady. And she came in, you know, and she's kind of got this posture. And she said, well, you know, and she's pointing at her husband, yeah, he won't walk next to me because he's embarrassed. He says I walk like an old lady. So about 3 months later, I'm measuring her pelvis, because it's one of the ways that I can tell if you're out of alignment or not. So I'm measuring her pelvis, and I'm noticing she's in a moo-moo, and she's standing just straight like this. And I looked at her and I said, so, Husband's still walking back behind you, huh? And she looked at me and she goes, well, I haven't thought about that. I can't think of the last time he's done that. Her posture at 81 shifted and she's standing upright. So it literally changes the posture of the body. So let's talk a little bit about how the body works. Now we all know that your brain has to communicate to the body in order for the body to function. Everybody knows that. If you're decapitated, your body's not functioning. We're not chickens, you know. So if your brain is communicating to your body, the network that it uses, the cable network that it uses are nerves. Now, I know this is kind of hard to read and it wasn't really intended that you're to read it all. It's just kind of a graphic explanation of the brain, and it's connected to every function in the body, all the way to your toes, how your stomach functions, how your blood functions in your body, your hormones, your chemicals. Everything is all controlled by the brain through a network of nerves that goes through your body. Now, if you have interference anywhere in those nerves, then something is not going to function. So how do we get interference with nerve? Well, it takes the weight of a dime on a nerve for the nerve to start to atrophy or not to function properly. So what I mean by atrophy is, so say you have your arm in a cast for 6 weeks, and you take the cast off, and you know your muscles have shrunk a little bit. But as soon as you start working that, if you go to oh, there you go. Could you raise your cast? So you'll be the prime example in 6 weeks after you get that off. But your muscles start to atrophy, they start to shrink. But when you get that cast off, you start regenerating those muscles and rebuild those muscles, they come back. Well, nerves generally do the same thing. As soon as you remove interference with the nerve, I use the analogy of stepping on a garden hose and taking your foot off the garden hose. Then the nerves start to rebuild and the body starts to heal, or that area starts to heal. So now this chart is a very interesting chart. Everybody's got, there's a chart on the table, so I put it out there because it's kind of hard to see on this screen. But say that you have interference at T2. Now T2 functions the heart, the lungs, and the bronchial tubes. Now, if you have some interference, the weight of a dime, on that nerve, you can have symptoms like asthma, bronchitis, fatigue, and fluid retention. Say you have T11. Now we're talking about kidneys and intestinal area. Say you're talking about T4, gallbladder, heart, lungs. So now taking that into consideration, let's go back to this slide here. Now say that the interference is up here at the base of the skull. Before any of these nerves even get their start, it can affect anything in the body. So what the brainstem does, this area at the base of the skull, it literally controls the function of everything in the body. How the heart beats, the lungs function, muscles, digestive tract. So does everybody remember Christopher Reeves? The original Superman and the Superman movies. He fell off a horse and had 1 millimeter of damage, not interference, but damage to his brainstem. He was on a pacemaker, a respirator. He was a paraplegic. He ended up dying because he had no immune system left because his body couldn't fight infection. That's what he died of. And so imagine just having a little pressure on that brainstem, how it can affect your whole body. So the benefit of removing the pressure off the brainstem and allowing the body to start functioning the way it's supposed to can be huge in many ways. Now, let's look at the other aspect of the brainstem. This area, which a lot of people don't know, controls the posture of all the body. It controls all of your postural muscles up and down the spine. So when you have interference at this brainstem level, you're going to generally have, I'll have patients come in, and a lot of times they're really kind of freaked out. I had a lady in today, and she had a pelvis that was off by 1.25 inches. She's like, oh my gosh, you know, that's me, you know, but it affects the posture of all of your muscles, your postural muscles up and down your spine. So what does that mean? Well, if I had a guy that was a marathon runner, and he also had 1.25 inches off in the pelvis. So can you imagine putting that many miles on your body in that much imbalance? You know, that just is common sense to us. Your body's going to start to break down. Well, if you have that much imbalance in your body and you're not a marathon runner and you're not 30 years old, but you're 50 years old and you've been walking 30 years off balance, same things start to happen. So what happens is all of these muscles and tendons and ligaments that are supporting your posture, now they're stretched, now they're tensioned, now they're becoming scarred because they get scar tissue in the muscles when you have chronic tensions in those muscles. So all of the scaffolding in your body is under stress. Now the other thing that happens is that when the bones are not properly aligned because of this misalignment, all of your spinal bones are supposed to sit even. Now, I use the analogy of a s'more. Everybody knows what a s'more is, right? So you have a graham cracker here and a graham cracker here and a marshmallow in between. Now the marshmallow in between is your disc. So if you start pinching down on this side and start going like this, what's going to happen to that marshmallow? It's going to start bouncing out this side. There's a bulging disc for you. Okay? Now the bulging disc, because the nerves come out of the side of those bones, now we got pressure on nerves, now we got numbness tingling down the arms, now we got sciatic pain. When you have all of those tension wires in your body, those muscles and tendons, and they're stretched like this over time, now we got neck pain, now we got low back pain, etc. So straightening out that posture can relieve tension off of those nerves, can pull those discs back to where they're supposed to go, and also start to balance and relax all that stressed tension going down in the muscles, tendons, and ligaments. So the question is, how does this happen? So we have this head that is the weight of a bowling ball. It's about 18 pounds on average. Some people 25, some people, no, I'm kidding. So about 18 pounds, all right? It sits on a 10-ounce bone. So you have things that happen starting with birth trauma. You have repetitive motion injuries, sleeping wrong, banging your head, all of these type of things that chances that that 10-ounce bone is not going to be a little misplaced and healed out of place are pretty slim. Now, I have patients that have come into me and said, oh, you know what? Never been in a car accident, I've never fallen, I've never had an injury, nothing has ever happened to me. I'm like, really? So for those people, then I show this video. Now look at Dad, he doesn't know what to do. He's like, you gotta skip the ads, you know. This is my favorite one.
The canning show. I'm going to be doing a stuffed animal dog show. Here's what I want you to do. I want you to make video response of yourself doing the stuffed animal dog show too. We'll see a lot of people. I'm going to see who's the best. Okay, here's what I'm going to do. I'm going to be in front of the closet. Okay.
Okay, so my point of all that is that we walk on two legs, and it's relatively impossible that we've made it to the ages that we all are and never have fallen, never have hit your head, never have any kind of an incident. Things happen, you know, and even if you don't recall it off the top of your head, you know, you can ask your mom and she can remember some things that happened to you, you know. I had a lady that came in and goes, well, I asked my mom and she never told me. I fell like off the crib and cracked my head and I was wondering why, you know. So how do you know if you're out of alignment? Well, obviously your friends and family have set you up for an opportunity that you can't turn down. But no, I'm actually, the reason that they invited you here as well, not knowing to them, is that I offer you a free opportunity to come into my office. It's an hour-long consultation, and we do several exams. I do some very technical computerized exams. I do a thermography exam that can detect nerve interference. I do a EMG, it's called. It's kind of like a EMG that they do on your heart, but it's measuring your muscle tension imbalance. We do laser posture analysis. We do several of these things and see if it looks like you've got an issue at the brainstem level. And if that's the case, then at that point in time, you can decide what you want to do. If you want to continue with care and you want to see if we can do something about it, or if you just want to take the information. The only catch is that when you go up, when you're leaving, that you stop with Chris and you make an appointment tonight. What she'll do is she'll give you a certificate. That certificate is worth $165 because that's what that appointment normally goes for. And so she'll give you that certificate, you bring that into my office, and then we waive all the charges, and so there's no charge for that. So my gift to you, and aside from the dinner, is that I would love for you to come into the office and at least check to see if there is something we might be able to help you with. I hate to see anybody with issues, and obviously your friends and family do the same, you know, and they want to afford any kind of opportunity that might benefit you. So at this point, I don't have anything else for you tonight. I hope everybody enjoyed the dinner. I hope you received a little information that could benefit you. And if you have any questions, you can always come up and talk to me afterwards. Chris is in the back, like I said. She will be making appointments for consultations. And thanks again for coming, and it was nice meeting you all that I haven't met before. Thank you. Hi.